You just got into a nasty accident and now you're rushed to the hospital because you're in need of immediate care. Once you're in the hospital, who are some of the first people you see? It's not the doctor, not even some intern or even the surgeon, but it's the nurse that you will most likely see first. The nurses in the hospitals are always on the front line in a variety of situations ranging from vehicular accidents to diseases. And I can promise you that whenever you're in a hospital, you're guaranteed to see nurses running around. When nursing first became a profession, it wasn't as respected as it is today. In fact, nurses used to be exclusively women and doctors used to be exclusively men. But now it wasn't until recently that men started to become nurses and women started to become doctors, and it's only benefited the medical field. Early nurses were actually more in the church and more related to the church than they are today. Now, you don't have to be affiliated with the church to be able to become a nurse. Actually, religion really doesn't have anything to do with nursing nowadays. Nursing has just become more advanced throughout the years because as technology changes, so do the ways that we treat people. So nurses have needed to evolve over the years. And being a nurse comes with the stigma that they only know how to do this or they only know how to do that. And they don't really acknowledge what nurses can accomplish. However, with all the work that's required to become a nurse, it's undoubtedly one of the hardest professions in the world. So all the technology means that we nurses have to constantly learn and adapt and evolve to keep with the times in order to properly use technology that will be used to save you one day. So as a nurse, you're required to perform an array of tasks that are vital in the treatment of each and every patient. It can range from simple to complicated, but they're all required to keep the patient healthy and to keep them alive. As the nurse, you're usually the direct caretaker of the patient. This entails managing their daily activities, their medications, as well as assessing the patient depending on how bad they are every 30 minutes, every hour, it just depends. Some of the things that they're required to do is take vital signs. Now, vital signs include blood pressure, heart rate, breathing rate, temperature, and these are just a few of the things that they need to take upon you entering the hospital. But it's not limited to these things because you're also watching how the patient moves, what their eyes look like, things like breath, and the nurse have to be aware of all of these things while you're in the hospital. Because patients are usually in the hospital for an extended period of time, that means nurses are constantly monitoring them to make sure that their state of being doesn't fluctuate too rapidly because that can cause drastic results. These are extremely important because vital signs can be a precursor to conditions that the patient may not be aware of. They may not know that they have certain diseases, but the vital signs can show that this is happening so they can treat it with the quickness. Nurses are also required to start IVs, to draw blood, so this requires an extreme amount of skill with a needle close to veins. So that in and of itself can tell you how important it is for nurses to be smart, to be skillful in what they do. So you may be asking why this stuff is so important. Well, because the nurses spend so much time with the patients, they are going to see what goes wrong before the doctors do because the nurses are always there and doctors are roaming all around the hospital or doing procedures and things like that. So once you become a nurse, it's not the end of your development because there's so many different things that you can do as a nurse. So once you first become a registered nurse or a RN, you'll most likely be at bedside to gain experience. And it can take from anywhere from 1 to 2 years for you to gain a good amount of experience before you can start moving to other departments and learn different subsets of nursing. So you might be, after 1 to 2 years, you might have discovered what you're passionate about. So you could become an ICU nurse or critical care, so you're in ICUs, trauma units, things like that. You could become a pediatric nurse, so you're working with children, pediatrician offices, or you could become even a nurse manager or a public health nurse. A public health nurse, they work with the government, they work with schools, things like that. So you don't necessarily have to be in a hospital just because you're a nurse. That's a stigma that has been perpetuated throughout the years, but it's not true. If you're a nurse case manager, you can even work from home, working for insurance companies and things like that to make sure that the medical side of it is being handled properly. And then arguably the most important role of a nurse is being the advocate for the patient. Patient advocacy is one of the most important roles of being a nurse. And it is why nurses are so important, because they are making sure you as the patient are being taken care of, and they're making sure that no matter what, even if the doctor says something else or the family wants something else, they're there for the patient, not for anybody else. So they make sure the patient understands, make sure that even if they're unconscious, they're being cared for in the best way possible, and that no one is jeopardizing their health. So today I've explained to you why nurses are so important in the healthcare setting. They're the blood running through the veins of the hospital, and they keep things running smoothly by doing the little things that you might not even think of go on in the hospital. Every task they perform is vital to the health of a patient. After becoming a nurse, you're not just limited to being just a nurse. You can do so many other things. And you're an advocate for the patient. You're why the patient will leave out of the hospital healthy. So nurses aren't just someone that gives you medicine or takes your temperature, but they're an important part of the healthcare system.